Hello student, today we will see the anatomy and physiology of digestive systems. So this is the structure of digestive system. So there are salivary glands are present, tongue, epiglottis, esophagus, stomach, pancreas, ileum, colon, rectum, anus. On the other hand, appendix, cecum, gallbladder, duodenum, liver, salivary gland are present. So these are the structures of digestive system. We will see what is the digestive system. The gastrointestinal tract. There are other names also are present: digestive tract, digestional tract, GI tract, GIT tract, gut or alimentary canal ಅಂತ ಕರೀತಾರೆ. ಸೊ ಈಸ್ ಎನ್ ಆರ್ಗನ್ ಸಿಸ್ಟಮ್ ವಿತಿನ್ ದ ಹ್ಯೂಮನ್ ಆ್ಯಂಡ್ ಅದರ್ ಎನಿಮಲ್ಸ್ ಒಳಗೆ ಪ್ರೆಸೆಂಟ್ ಇರ್ತದೆ. ಇಲ್ಲಿ ಏನು ಮಾಡ್ತದೆ, ಫುಡ್ ನಾವು ತಗೋತೀವಿ, ಅದನ್ನು ನಾವು ಡೈಜೆಸ್ಟ್ ಮಾಡ್ತೀವಿ ಆ್ಯಂಡ್ ಅದ್ರೊಳಗಿರೋ ಎನರ್ಜಿನ ಮತ್ತು ನ್ಯೂಟ್ರಿಯೆಂಟ್ಸ್ ಅಬ್ಸರ್ವ್ ಮಾಡ್ತೀವಿ ಮತ್ತು ಆಸ್ ಎ ವಿಲ್ ಎಕ್ಸ್ಪೆಲ್ ಇಟ್ ದ ರಿಮೈನಿಂಗ್ ವೇಸ್ಟ್ ಆಸ್ ಅ ಫೀಸಿಯಾ ಆ್ಯಸ್ ಎ ಸ್ಟೂಲ್ ಆಗಿ ನಾವು ಇದನ್ನು ಹೊರಗೆ ಹಾಕ್ತೀವಿ. ಸೊ ದರ್ ಆರ್ ಮೇಜರ್ ಆರ್ಗನ್ಸ್ ಆಫ್ ಡೈಜೆಸ್ಟ್ ಸಿಸ್ಟಮ್. ದರ್ ಮೌತ್, ಫ್ಯಾರಿಂಗ್ಸ್, ಈಸೋಫೆಗಸ್, ಸ್ಟಮಕ್, ಸ್ಮಾಲ್ ಇಂಟೆಸ್ಟೈನ್, ಲಾರ್ಜ್ ಇಂಟೆಸ್ಟೈನ್ ಆ್ಯಂಡ್ ರೆಕ್ಟಮ್. There are also accessory digestive organs like liver, gallbladder, pancreas, salivary gland. So what is the function of GI tract? ಏನು ಮಾಡ್ತದ ಕೆಲಸ? Function of GI tract is ingestion. Ingestion ಅಂದರೆ taking the food in the alimentary tract. Element means eating, drinking. Next is propulsion. Mix and moves the content along the alimentary canal. ನಮ್ಮ ಮೌತ್ ಒಳಗೆ ನಾವು ಏನು ತಿಂದಿರ್ತೇವಲ್ಲ that will all mix ಆಗ್ತದೆ and then it will go move. Next is digestion. There are two types of digestion. One is mechanical breakdown and the chemical digestion. So the question they will be asked in the exam, there are two types of digestion. Name the two types of digestion: mechanical and the chemical. Mechanically, mastification, chewing. ನಾವು ಅದನ್ನು ಕಡಿತೇವಿ, ನಾವು ಅದನ್ನ chew ಮಾಡ್ತೇವಿ. So that is what mechanical. Chemical digestion of food into a small molecule by enzymes, ಹಾರ್ಮೋನ್ಸ್. ಸೊ ಇದು ಕೆಮಿಕಲ್ ಡೈಜೆಷನ್ನ ನಮ್ಮ ಬಾಡಿ ಒಳಗೆ ಟೇಕ್ ಪ್ಲೇಸ್ ಆಗ್ತದೆ. ಸೊ ದೇರ್ ಆರ್ ಟೂ ಟೈಪ್ ಆಫ್ ಡೈಜೆಷನ್. ಒನ್ ಇಸ್ ಮೆಕ್ಯಾನಿಕಲ್, ಅನದರ್ ಒನ್ ಇಸ್ ಕೆಮಿಕಲ್. ನೆಕ್ಸ್ಟ್ ಇಸ್ ಅಬ್ಸಾರ್ಪ್ಷನ್. ದಿಸ್ ಈಸ್ ದ ಪ್ರೊಸೆಸ್ ಬೈ ವಿಚ್ ಡೈಜೆಷನ್ ಫುಡ್ substance pass through the walls of some organs of the alimentary canal into blood for the circulation. Absorption ಅಂತ ಏನಾಗ್ತದೆ, ಡೈಜೆಸ್ಟ್ ನಮ್ಮ ಫುಡ್ ಏನು ಡೈಜೆಸ್ಟ್ ಆಗಿರ್ತದಲ್ಲ ಅದೇನಾಗ್ತದೆ, ಇಟ್ ವಿಲ್ ಪಾಸ್ ಥ್ರೂ ದ ವಾಲ್ಸ್ ಆಫ್ ಆರ್ಗನ್. ಸೊ ಲೈಕ್ ಸ್ಟಮಕ್, ಈಸೋಫೇಗಸ್, ಗಾಲ್ ಬ್ಲ್ಯಾಡರ್. ಸೊ ಇದೆಲ್ಲ ಹೋಗಿ ಆಲ್ ದ ಸಮ್ ಆರ್ಗನ್ ಒಳಗೆ ಏನಾಗ್ತದೆ, ಅಬ್ಸಾರ್ವ್ ಆಗಿರ್ತದೆ ಆ್ಯಂಡ್ ಫಾರ್ ದ ಬ್ಲಡ್ ಆಮೇಲೆ ಬ್ಲಡ್ ಥ್ರೂ ಸರ್ಕ್ಯುಲೇಟ್ ಆಗಿರ್ತದೆ. ನೆಕ್ಸ್ಟ್ ಇಸ್ ಎಲಿಮಿನೇಷನ್. ಫುಡ್ ಸಬ್ಸ್ಟೆನ್ಸ್ that have been eaten but cannot be digested and absorbed are excreted by alimentary canal as a feces by the process of defecation. ಬಾಡಿಗೆ ಏನು ಫುಡ್ ಬೇಡ ಆಗಿರ್ತದಲ್ಲ ಅದೇನಾಗ್ತದೆ, ನಮ್ಮ ಬಾಡಿ ಅದನ್ನು ಡೈಜೆಸ್ಟ್ ಮಾಡೋಕ್ಕಾಗ್ದಿರೋದಿಲ್ಲ, ಅದನ್ನು ಅಬ್ಸರ್ವ್ ಮಾಡ್ಕೊಳಕ್ಕೆ ಆಗ್ದಿರೋಲ್ಲ. ಅದೇನು ಮಾಡ್ತದೆ, ಇಟ್ ವಿಲ್ ಎಕ್ಸ್ಕ್ರೀಟ್ ಟು ದ ಎಲಿಮೆಂಟರಿ ಕೆನಾಲ್ ಬೈ ಥ್ರೂ ದ ಪ್ರೊಸೆಸ್ ಆಫ್ ಡೆಫಿಕೇಷನ್. ಸೊ ದ ಫಸ್ಟ್ ಆರ್ಗನ್ ಆಫ್ ಆರ್ digestive system is mouth. The mouth is the first portion of alimentary canal. It will receive the food and it will produces the saliva produce ಮಾಡ್ತದೆ, ಫುಡ್ನ ರಿಸೀವ್ ಮಾಡ್ತದೆ. the first portion of the alimentary canal. The oral mucosa is the mucous membrane epithelial lining inside the mouth. So there inside the mouth there are the mucous membrane epithelial lining that will help for the chewing, for the food mix and move ಆಗ್ಲಿಕ್ಕೆ that mucous membrane will help. What are the relation of the mouth? Anteriorly, in front of there are lips are present. At the back side there are oropharynx are present. Oropharynx. Laterally there are cheeks. Both sides there are cheeks are present, and superior above there is a hard palate or bony hard palate is situated. Inferior there is a tongue, soft tongue is present, and tissue of the floor of the mouth. So there are plates are present on the roof of the mouth. They are divided into two types. There is anterior hard palate. There is a in front. You can check. You can put the hand at the upside of your mouth. You can check there is a hard palate in the front and there is a soft palate at the back side. So anterior and the posterior, they are divided into two types. So the vulva, you can see the small when you open the mouth widely, you can see the small tongue that is called as vulva is covered with the fold mucus covered agirtada, hanging. It will in the middle of, you will see that hanging in the middle. So it will help for your voice, you can help for moving the food down. So all these things. Next is tongue. It's a muscular organ. The all our muscle are present in that. It will help manipulate, means from ಒಂದು ಕಡೆಯಿಂದ ಇನ್ನೊಂದು ಕಡೆ ಹೋಗಲಿಕ್ಕೆ ಏನು ಮಾಡ್ತದೆ, ನಾವು ಚೀವ್ ಮಾಡುವಾಗ ಒಂದು ಸೈಡ್ ದ ಟಂಗ್ ಆ್ಯಂಡ್ ಆಲ್ಸೋ ಆ್ಯಕ್ಟ್ ಫಾರ್ ಸ್ವಾಲ್ವಿಂಗ್ ಅಂತ ನಾವು ನುಂಗ್ಲಿಕ್ಕೆ ಅದು ಹೆಲ್ಪ್ ಮಾಡ್ತದೆ. ಯಾವುದೋ ಟಂಗ್ ಇದೊಂದು ಇಂಪಾರ್ಟೆಂಟ್, ನಮ್ಮ ಡೈಜೆಸ್ಟಿವ್ ಸಿಸ್ಟಮು ಇಂಪಾರ್ಟೆಂಟ್. ಅದಿರಲಿಲ್ಲ ಅಂದ್ರೆ ನಾವು ನುಂಗೋಕ್ಕಾಗೋದಿಲ್ಲ, ಮ್ಯಾಸ್ಟಿಫಿಕೇಷನ್ ಮಾಡಲಿಕ್ಕಾಗೋದಿಲ್ಲ. ಸೊ ಇಟ್ ಈಸ್ ಅ ಪ್ರೈಮರಿ ಆರ್ಗನ್ ಫಾರ್ ಟೇಸ್ಟ್. ನಮಗೆ ಟೇಸ್ಟ್ ಬರಲಿಕ್ಕೆ, ಇವಾಗ ಡೈಜೆಸ್ಟಿವ್ ಸಿಸ್ಟಮ್ ಅಂದರೆ ನಾವು ಊಟ ಮಾಡ್ತೇವೆ ಅಂದ್ರೆ ನಮಗೆ ಟೇಸ್ಟ್ ಅಂತೂ ಬರಲಿಕ್ಕೆ, ಸೊ ಅದಕ್ಕೆ organ for the taste. So this tongue, the upper surface ಏನಿರ್ತದೆ at the dorsum, there are taste buds are present. There are numerous at the linguinal papilla. I will show the diagram in the next video. I will only see the linguinal papillae, so you can keep it in mind. At the linguinal papillae there are taste buds are present. Human tongue is divided into oral part in the front and the pharyngeal part at the back. Blood supply is by linguinal artery and external carotid artery, and venous drainage is linguinal vein and internal jugular vein. So nerve supply by hypoglossal nerve, and taste and sensation is by a glossopharyngeal nerve. You have to keep this all the blood supply, venous supply, nerve supply. They will ask in the exam. So there are simple notes I am providing. You can go through this one only. This is the structure of tongue. There are filiform papillae, foliate papillae, linguinal tonsils, palatine tonsils, fungiform papillae, circumvallate papillae. So this is what the diagram of the tongue. You can take the diagram of the tongue. Next is the function of tongue: mastification, deglutition, speech and taste. Mastification is chewing, ಕಡಿಯೋದು. ನಾವು ಫುಡ್ ನಾವು ಮೌತೊಳಗೆ ತೊಗೊಂಡು ಕಡಿತೇವಲ್ಲ, ಸೊ ದ್ಯಾಟ್ ಇಸ್ ವಾಟ್ ದ chewing. Deglutition means swallowing, ನುಂಗುವುದು. Speech, taste, used for the function of the tongue. Next is teeth. The human teeth function to mechanically break down the food items of the food by cutting and crushing. ನಮ್ಮ ಟೀತ್ ಏನು ಮಾಡ್ತದ, ಫುಡ್ ಐಟಮ್ಸ್ ನಾವು ಯಾವಾಗ ನಾವು ಮೌತ್ ಒಳಗೆ ತೊಗೋತೀವಲ್ಲ, ಇಟ್ ವಿಲ್ ಬ್ರೇಕ್ ಡೌನ್, ಇಟ್ ವಿಲ್ ಚೀವ್, ಕಟ್ ಮಾಡ್ತದ, ಕ್ರಷ್ ಮಾಡ್ತದ. ಇಟ್ ವಿಲ್ ಪ್ರಿಪೇರ್ ಫಾರ್ ಸಾಲೋವಿಂಗ್ ಆ್ಯಂಡ್ ಡೈಜೆಸ್ಟಿಗೆ ನಮ್ಮ ಫಸ್ಟ್ ಟೀತ್ಗಳು ಏನೋ ಪ್ರಿಪೇರ್ ಮಾಡ್ತಾವೆ. ಹ್ಯೂಮನ್ಸ್ ಹ್ಯಾವ್ 4 types of teeth. You have to keep this one, which is the 4 type of the teeth. What are the 4 types of teeth? They will ask in the exam. One is incisors, canines, premolars and molars, each with a specific functions. All 4 have different functions. Incisor have different functions, canine have different function, premolars have different functions, and molars have different functions. You have to keep it in mind. So this is the where are the teeth are present, where is the incisors, where are the canines, where are the premolars and the molars. You can go through this, where are the teeth. They may be asked the teeth diagram. You can take this diagram, it will help for you only. So there are primary teeth. Among deciduous teeth, 10 are found at the maxilla, upper jaws, at the 10 at the mandible. The upper teeth are called as maxilla and the lower is called as mandible. So at the upper there are 10 are present and the lower at the 10 are present. Total 20 teeth are present. These are the primary teeth, also called as deciduous teeth. So the dental formula, we have to keep this dental formula: 2.1.0.2 divided by 2.1.0.2. So this is what the dental formula. Start to come with the erupt at 6 months of age. When at the 6 month, when the baby is 6 months, at that time the teeth will be erupt. In the primary set of teeth, there are 2 types of incisor only. There are 2 types of incisor: centrals and laterals. 1 canine are present and 2 type of molar, first and second. All primary teeth are normally later replaced with their permanent counterparts. So all that primary teeth are lost, broken down, and they are replaced by the permanent counterpart. Means permanent teeth are when the baby is at 8 years, 9 years, 10 years. It may differ from individual to individual. Next is permanent teeth. Among permanent teeth, 16 are found at the maxilla at the upper and 16 at the mandible, lower jaws. Total there are 32 teeth. So the dental formula change in permanent teeth, that is 2.1.2.0 divided by 2.1.2.3. Next, age. At the age of 21, all 32 of permanent teeth have usually erupted. So at the 21 of age, all the permanent teeth are erupted. So in that permanent teeth, there are two type of incisors, one canine, two premolar, three molars are present. Incisor help for cutting, one canine is help for tearing, two premolar help for crushing, and three more for grinding, mixing. So there are molar, first, second, and third molar are present. This is the diagram of teeth. So there is enamel at the top, there is enamel, after that dentine, there is gums are present, pulp, nerve and blood supply, bone. In this side, crown, upper part is crown, other than there is a neck, and there is a root part is present. Parts and the individual work. Enamel at the top. Enamel is the hardest and mostly highly mineralized part of the substance, mineralized part of the heart, what we call as white, you can see that is what the enamel. So it is the four major tissue in the mother, the four major tissue in there which make up the tooth, along with dentine, cementum, and dental pump. So all these are made up of four type of major type of tissue. 96% of enamel consists of minerals irtada, water irtada, organic material irtada, so all other than rest of it. So normal color of that enamel will be light yellow to grayish white. ಸೊ ಕಲರ್ ಏನಿರ್ತದಲ್ಲ ನಮ್ದು ಡೆಂಟಲ್ ಎನಾಮಲ್ ಏನಿರ್ತದ ಇಟ್ ಮೇ ಚೇಂಜ್ ಎಲ್ಲೋ ಇನ್ ಲೈಟ್ ಎಲ್ಲೋ ಟು ಗ್ರೇಷ್ ವೈಟ್. ನೆಕ್ಸ್ಟ್ ಈಸ್ ಡೆಂಟಿನ್. ಡೆಂಟಿನ್ is a substance between the enamel or the cementum and the pulp chamber. So it is a between the enamel and the pulp chamber ನಡಕ್ ಡೆಂಟಿನ್ ಇರ್ತದ. ಸೊ ಇಟ್ ಈಸ್ ಯೆಲ್ಲೋ ಕಲರ್ ಇರ್ತದ, ಮೇಡ್ ಅಪ್ ಆಫ್ 70% of inorganic material, 20% of organic material, and 10% of water. So this is what the enamel and the dentine functions and what they contain. Cementum is a specialized bone like irtada, and it is cover the root of the tooth. In ನಮ್ಮ roots ಇರ್ತಲ್ಲ ಅದನ್ನು ಕವರ್ ಮಾಡ್ತದೆ, that is cementum, and it is like bone like ಥರ ಇರ್ತದೆ. It is yellow in color, soft ಇರ್ತದೆ. Dental and enamel ಕಿಂತನೂ ಏನಿರ್ತದೆ, cementum is very soft. Next is dental pulp, is a central part of the tooth. It is filled with the soft connective tissues are present in the dental pulp. It's a central part. So this tissue contain blood vessels and nerve that enter the root tooth from the hole at the apex of the root. So you can see when you make teeth, when you see your teeth, you can observe. Next is the function of teeth. There are two incisor, one canine, two premolar, three molar. They have incisor help for cutting, canine for tearing, premolars for crushing, molar for grinding. Eruption ಯಾವಾಗ erupt ಆಗ್ತಾವೆ, ಇದೊಂದು process tooth develop in which the teeth enter the mouth and become visible. It will enter in the mouth and they will become visible. That is called as eruption. Primer erupt in the month of the age of 6 until 2 years ಮಟನ್ ನಮ್ಮೇನಾಗ್ತದೆ teeth erupt ಆಗ್ತದೆ. It may change. I told you it means 6 to 2 years the teeth eruption take place. Blood supply is by maxillary artery, venous drainage by internal jugular vein, nerve supply, maxillary nerve, and mandibular nerve. You can keep these only arteries, veins, and nerves in your mind. Next will be the salivary glands. Salivary glands are exocrine gland that produce the saliva. Salivary gland produce saliva. So there's exocrine glands. So through a system of duct they produce through a duct or present duct. There are glands are present. Human have three pair of salivary glands. One is parotid, submandibular, and sublingual. So we have to keep in mind there are three types of salivary gland. One is parotid, submandibular, sublingual. So there are hundreds of salivary glands, but these three are very important. That parotid gland, submandibular gland, sublingual gland. Parotid gland, the two parotid glands are major saliva. So major one is parotid gland. They are wrapped up around the mandibular ramus in human. The largest of the saliva, which is the largest saliva, that is parotid gland. So this is what the glands are present at the ear. You can see the parotid gland, submandibular gland, and sublingual glands are present. So they secrete saliva. Glands will secrete saliva for helping for mastification, for chewing and swallowing. So and it will begin at the digestion of starch. ಯಾವಾಗ ಸ್ಟಾರ್ಚ್ ನಮ್ಮ ಬಾಡಿಯೊಳಗೆ ಸ್ಟಾರ್ಚ್ ಹೋಗ್ತದಲ್ಲ, ಯಾವಾಗ ಡೈಜೆಸ್ಟ್ ಆಗ್ತದಲ್ಲ ಆಗ ನಮ್ಮ ಸಲೈವ ಪ್ರೊಡ್ಯೂಸ್ ಆಗಲಿಕ್ಕೆ ಸ್ಟಾರ್ಟ್ ಆಗ್ತದೆ. ಸೊ ಇಟ್ ಎಂಟರ್ ದ ಓರಲ್ ಕ್ಯಾವಿಟಿ ವಿಯಾ ಪೆರಟೈಡ್ ಡಕ್ಟ್. ಡಕ್ಟಿಂದ ನಮ್ಮ ಸಲೈವ ಎಂಟರ್ ಆಗ್ತದೆ. ನೆಕ್ಸ್ಟ್ ದ ಸಬ್ಮ್ಯಾಂಡಿಬ್ಯುಲರ್ ಗ್ಲ್ಯಾಂಡ್. ದ ಸಬ್ಮ್ಯಾಂಡಿಬ್ಯುಲರ್ ಗ್ಲ್ಯಾಂಡ್ಸ್ ಆರ್ ದ ಮೇಜರ್ salivary gland located beneath the lower jaws. So submandibular present at the beneath means lower jaws allirtada alli present irtada, superior to digastric muscles. So the secretion produced is a mixture of both serous fluid and mucus. In that present there is also serous fluid is also present, there is a mucus also present. It will enter the oral cavity via submandibular duct. Sublingual glands. The sublingual glands are the pair of major salivary glands. They are located inferior to the tongue ಕೆಳಗಡೆ ಪ್ರೆಸೆಂಟ್ ಇರ್ತಾವೆ. ಆಮೇಲೆ ಸಬ್ಮ್ಯಾಂಡಿಬ್ಯುಲರ್ ಗ್ಲ್ಯಾಂಡ್ಸ್ ಮುಂದೆ ಪ್ರೆಸೆಂಟ್ ಇರ್ತದೆ, ಆ್ಯಂಟೀರಿಯರ್ ಟು ಸಬ್ಮ್ಯಾಂಡಿಬ್ಯುಲರ್ ಗ್ಲ್ಯಾಂಡ್ಸ್. ಅಪ್ರಾಕ್ಸಿಮೇಟ್ಲಿ 5% ಸಲೈವ ಒಳಗಿನ 5% ಸಲೈವ ಪ್ರೊಡ್ಯೂಸ್ಡ್ ಬೈ ದ sublingual glands only. So these in glands they will produce it, that is in the mucus in nature. So there are 800 to 1000 minor salivary glands located throughout the oral cavity within the submucous of the oral cavity. So there are 800 to 1000 present are there. Blood supply for the tongue is by external carotid artery, venous drainage is by jugular veins, and composition of saliva. There is 1.5 liter daily produce ಆಗ್ತದೆ. ನಮ್ಮ saliva daily 1.5 liter saliva produce. It is consist of water ಇರ್ತದೆ, minerals ಇರ್ತದೆ, enzymes, mucus, lysosomes, immunoglobulins, all these are present in the saliva. So these are composition of saliva. Next will be function of saliva. Saliva for the digestion of food, to maintain the oral hygiene. Without any salivary function, the frequency of there is a dental caries ಆಗ್ತದೆ, gum diseases and other oral problem increases. Help for the lubricant. Saliva coat the oral mucosa mechanically. It will help for the trauma during eating, swallowing, speaking. Saliva help for the trauma by eating, swallowing and speaking. In the people with saliva soreness irtadalla, mouth is very common and the food sticks to inside the mouth. So in some people there is a saliva soreness will take place. It is very common and the food stick to the inside the mouth, it's also common. So all these are the common things. Help for the lubricants also. Next will be the digestion. The digestive function of saliva include a moist. It will make the food moist ಮಾಡ್ತದೆ. Help to create the food balls. Balls means when the food mix with the saliva it will become balls. So that is what the balls ಅಂತ ಕರೀತಾರೆ. So this lubricative function of saliva allow the food to pass easily through the digestive tract. So saliva is very important for the sense of taste. Without saliva we cannot taste the food. Next is it is in a liquid medium ಇರ್ತದೆ. In the saliva there are chemicals are present that will carry to the taste receptor cells. Thank you for watching. Please subscribe and click bell icon button for more such videos.